here today to talk about trachs and how we use them here in the ER. I know everyone's typically a little bit scared when we talk about trachs just because it is, a tube in someone's airway, but the good news is that they have an airway and it is stented open so you can provide the ventilation that they need. So there are two different types of trachs that we use here at Lurie. We have Shileys or we have Bavonas. Typically the Bavonas are for the smaller patients and the Shileys are for the larger patients, but there are smaller and larger sizes of each. To break it down further, they can either have a cuff or they could have no cuff. If the patient has a trach with a cuff, it means at some point they're going to receive positive pressure. The positive pressure being that they are being bagged or they're on a ventilator. You can tell by looking at the trach if it is cuffed or uncuffed by this having this little tube that hangs off to the side. Basically you inflate it and then it stents open the airway so that when the positive pressure is going in, the air is not escaping and going out. You can see that this one here doesn't have the balloon or anything hanging off to the side, so this one does not have a cuff. To further break down if the patients are going to be receiving positive pressure or not, we can think about the types of patients that we see. So there are patients that we have that are on room air, walking, talking, breathing on their own. The trach is just there to stent open their airway. Sometimes it is a temporary thing, or maybe they'll need it at some point, but they are breathing on their own and do not require any sort of positive pressure, so they would have an uncuffed trach. Then we have other patients that have a cuffed trach in, and frequently during the day they are breathing on their own, don't require any sort of positive pressure, but at night we're saving their respiratory function and they are on a ventilator. So when they're put on that ventilator, we have to inflate the cuff so we could provide that positive pressure overnight. Then the third type of patient that we have are going to be the ones that are ventilated 24/7. So they're going to be receiving positive pressure 24/7. So that cuff would be inflated all the time.